Doctors overdid it. What's something someone came to the hospital for that they thought wasn't a big deal but turned out to be much worse? Had a guy come in complaining of a cough and difficulty swallowing. He thought he had tonsillitis and just wanted some antibiotics. I noticed his voice was incredibly hoarse but there were no swollen tonsils, so sent him for a chest x-ray. Huge, baseball-sized tumors all throughout his lungs. One of them was pressing on the recurrent laryngeal nerve, causing his speaking and swallowing problems. He died within a week. Well, this thread is terrifying. My best friend's sister went to the hospital for what she thought was a lingering flu. She walked out with a diagnosis of bowel, stomach and liver cancer and died 9 months later. My dad went into the hospital in some pain. Back when he used to power lift, a nurse comes into the room, looks down at her chart, looks back up and says, "Mr. Pickle, you are having a heart attack." He got up on the bed and flexed, saying, "Does this look like a man that's having a heart attack to you?" She looked back down at her chart, up again, and says, "Yes. Sir, this is a no flex zone." Not a doctor, I'm an EMT, but when I was deployed to Afghanistan as a medic, a medevac pilot came in because he had a small abnormality on his flight physical EKG. Apparently this was something he had been getting waivers for years for. I had just finished an A&P class and learned about something called Brugada syndrome, which is basically an arrhythmia that causes sudden cardiac death in the patient. I jokingly mentioned how his EKG reminded me of the abnormality I saw in my textbook, thinking there was no way he actually had it and it had to be artifact from the EKG. The doctor's eyes widened and he sprinted out of the office. The pilot had it, was immediately relieved of flight duty, sent home and had a defibrillator put into his heart before being medically retired. TLDR, I accidentally diagnosed a man with certain death. Good for you. You saved his life. My sister-in-law thought she had a cyst on her shoulder. Nope. Round cell sarcoma. The doctors said she had 2 months. She lived for 8. When I was doing my hospital placements, a patient came in laughing and skipping for their scan. They thought 100% they were in remission and clear of cancer growth. I was spending a day with the scan techs and sat in. The scan didn't show one tumor, it showed hundreds. The guy was riddled with metastases. It was terminal. He had months. He was laughing and smiling with us. He asked if we could tell him how it went, and the tech said we couldn't. It was for the doctor. The old man winked at us and walked out. He was so happy. It was one of the days that told me I couldn't do that job. My mother woke up one day and her arm was numb. After about 45 minutes it was still pretty numb and she thought she had pinched a nerve in it sleeping, but went to the ER just in case. She had a stroke, which actually was caused by a blood clot, which moved up from her heart and exited a hole in her heart. A congenital defect she was unaware she had. She ended up fine and feeling in her arm came back, but she was incredibly lucky that it did. When I was 12 I had a crazy bad headache that wouldn't go away. My dad brought me to the doc and I didn't even make it to the exam room before they turned me back and sent us to the hospital. It turns out my headache was from a burst sinus cavity, as in all the bones around my eye broke and the liquid leaked back onto my brain, giving me brain meningitis. My eye was bulging out to the point where I looked like an alien and they told my parents I was not going to make it. Obviously I pulled through but was hospitalized for 2 weeks and missed 2 months of school. I was at the time only the 3rd known case of this happening and they had flown in doctors from all over the US and from the UK. Crazy stuff. I thought it was just the worst headache. Turned out to be so much more. The 7th of December, 2012. We brought my father-in-law to the ER because he just wasn't acting right, mixing words, feeling tired. My husband and I thought for sure he had a mild stroke. The ER staff thought he had a stroke too, because of his symptoms, and he was 79. They did a scan and nope, cancer. 3 huge tumors in his brain. We took him for more tests the next day and it was lung cancer. A tiny spot in his lung that traveled to his brain. He died 13 days later, on my husband's birthday. I'm a nurse. I cared for a patient that came in because she woke up with a severe headache and a knot on her head. She went to CT for a head scan and had 2 bullets in her head. One had gone in at the top of her head, just past her hairline and traveled under the skin, but on top of her skull to the back of her head. The other went straight in, but just fractured the skull behind her ear. didn't go all the way through the skull. They were smaller caliber bullets. Apparently, she went to sleep the night before after taking an Ambien and there was a drive-by shooting on her street. The bullets went through her window and she slept right through it. Note to self, never take Ambien, you will go into a freaking coma. Don't have much time so I will keep this short. Patient presented with a small, less than 1 inch, scratch on his right thigh and severe pain and immobility. On palpation there was crepitus, a cracking sound. We called in a surgeon in the hopes that we could excise the closed wound, but as soon as the surgeon cut the skin the leg deflated. Yes, deflated. The escaped air was horribly putrid in odor. We ordered an x-ray and discovered the leg was simply skin and bones without any signs of muscle. I regretfully informed the patient that we had a strong suspicion of a flesh-eating bacteria called Clostridium perfringens and that the infection was spreading fast. He called his family and loved ones, got a lawyer and said his goodbyes. 12 hours after admission he was declared dead. Where is this bacteria commonly located? My friend's mother was on vacation in Key West and as they were walking down the beach her husband pointed out that the toes on her left foot were all sandy and the other one wasn't. She had been kind of dragging the front of her foot, but only on the one leg. The mom vaguely mentioned that she'd been kind of having a little trouble lifting the front of her foot up, but figured she just strained something from running barefoot on the beach a few days earlier. She went to a doctor to see if she could get some anti-inflammatories. After questions and recommendations to see a specialist, they figured out that she has ALS, Lou Gehrig's disease. This was 6 years ago. Now she is totally unable to move, talk, and breath on her own. All she thought she had was a sprained foot. I thought I had a nasty flu strain, was feeling generally like crap, didn't go to hospital until 2 days later, was in operating room less than an hour after that. Appendicitis. Appendicitis is evil. I thought I had food poisoning. Not a doctor, but I was in a fender bender car accident. I was at fault and my lower back would not stop aching. I went into the ER figuring I had sprained the muscles in my back and that I would be prescribed muscle relaxers and maybe some pain pills. 6 hours, several x-rays, a CAT scan and 4 doctors later, I found out my spine was broken and, get this, healed. The best theory any of them could come up with was that my spine had broken during birth and since we never knew, it just healed itself, filling in with cartilage. One of the docs told me that had we known my spine broke at birth I would have likely never walked and would have been treated as handicapped my whole life. I didn't find out until I was 20 and already had a child. My mom cried because she always thought I was just a really colicky baby, when in fact I was probably in a lot of pain. That's really sad and terrifying. Parental guilt is horrible. Paramedic here. We got called out one Christmas for a grandfather who was tired after eating a huge turkey dinner. We get there and the first responders are standing around outside in high spirits. I walk in, slap a EKG on him. Massive MI, heart attack. Went from happy turkey coma to heart attack in 3 seconds. Frick it. If I'm going to die, let it be after a fantastic Thanksgiving dinner. This one isn't nearly as scary as the others, and I'm pretty late to the party, but here's my story. I have male pattern baldness, and needed a prescription for some hair growth medication from a dermatologist. The doctor said he would give me a prescription, but first wanted to do a full skin checkup, which he does for every new patient. I got annoyed by the fact that I had to strip naked in front of this guy just for hair medicine. A few weeks later I get a call. There was melanoma cancer on my back. They caught it early enough that it hadn't spread. That checkup saved my life. Not my story, but a good one. A guy was involved in a MVA and ended up dislocating his hip. Got him strapped in and taken to the hospital where they ended up popping his leg back in. Now, dislocating your hip isn't very common. The upper end of the thigh fits in like if you were to make a fist with one hand, and then cup your other hand around it from the top. There's also quite a few ligaments and tendons really holding it in there, so when they pop it back into place, there's a significant amount of force holding it in. Anyways, the guy was in pain but conscious during the transfer, and when they got him to the hospital, I forget what drugs they gave him, but he was still making sense and responding appropriately. This changed as soon as they put his leg back into his hip. PT immediately screamed and passed out. He then proceeded to wake up, scream, and pass out again. This happened several times while the doc started to panic trying to figure out what had gone wrong, eventually sending the guy for x-rays. Turns out that his testicle had rolled into the cavity between his hip and his femur, so when they popped it back in it crushed his nut. So, yeah, that turned out to be pretty goddamn serious I feel. Frick this. I'm at work I can be writhing in vicarious pain. A year or two ago here in Texas a woman went to her optometrist for a regular exam. She later told the news after a long silence he asks, "Did you drive here? Number. The person who drove you here needs to drive you to a hospital immediately. Why? Because you're about to have a stroke." That's amazing but also scary as heck. Imagine knowing the entire way to the hospital. Not a doctor, but my doctor told me if I had waited 12 more hours I probably would have died. So I was taking antibiotics for dental work that had been done, and noticed these weird blisters showing up everywhere. Weird, but whatever. 48 hours later, they started opening up, leaving holes in my skin. No blood, just lost most of the skin in that area. Again, weird, but I was working so whatever. Then they started appearing in my throat so I got to the hospital ASAP and was diagnosed immediately with Stevens-Johnson syndrome. Any longer and the layers of my skin would have literally peeled away from each other and I would have died. That was a sobering day. Not a doctor. Sorry I'm gonna be that guy. After I got my appendix out I went back a week later thinking I was constipated. Nope. I had a giant butt abscess that had started to wall itself off. They went in the drain it and I woke up in ICU 5 days later recovering from sepsis, septic shock and kidney failure. I saw a 55-ish woman at the ER last year. She asks us if she might have something wrong with her breast. During my exam, I couldn't help but notice that her left breast was bumpy, talking like 5 centimeters mass protruding. The nipple was inverted and leaking blood. Clearly a textbook case of cancer. The woman had a pretty high-paying job and seemed pretty smart, and was clearly in denial. Not a doctor, but this did happen to me. I had gallstones for 3 years or so before I finally got my gallbladder ripped out last year. At its worst, I was getting an attack maybe once a month or so I figured it couldn't be that bad. I went to the surgeon for my post-op checkup. He told me that my gallbladder was filled with hundreds of stones of varying sizes and that it was precancerous. Apparently, people don't typically get gallbladder cancer until they are in their 80s or 90s, and it is often very serious because people don't catch it right away. I'm in my 20s and like I said, I had been sitting on this problem for 3 years before I finally toughened up enough to get it checked out. Scary crap man. My mother died from gallbladder bile duct cancer. I was on my way to take her to the oncologist when I had my gallbladder attack me for the first and last time. I had that thing removed the next day and it was almost completely calcified. Thankfully not cancerous. My girlfriend is in her final rotations for radiology. A while back a young girl came in after winning a basketball championship. She had some shooting shin pain but wasn't in a lot of pain. Still glowing from the win and talking excitedly about a scholarship offer. When her scan came back about 60% of the marrow in her tibia was one big sarcoma. Cancer. Surgery and therapy essentially ended her shot at a full ride. I'm not a doctor but a few years ago I took a positive pregnancy test. I went to the doctor to confirm just thinking I would be getting some blood work done and maybe an ultrasound. They did the ultrasound but couldn't find a baby in my uterus so they told me it was ectopic, implanted in a fallopian tube, and I needed to have surgery to remove the baby. I went into surgery and woke up a few hours later. The first thing I remember is seeing my parents and my fiance crying. Turns out I was never pregnant. I actually had a tumor the size of my fist on my ovary and my body was reacting to it like a baby. I had an HCG hormone and everything. I'm 4 and 1/2 years in remission. My aunt fell down some stairs or something in January 2011. It really wasn't serious at the time we thought. Apparently her hips started not feeling right after that. She went to the doctor about it in the end of July-ish. She had cancer. It was everywhere. She was dead by September. You know people can go fast sometimes but we were not prepared for that. Not a doctor, but one night, I suddenly had serious stomach pains. After failing to sleep it off, My parents wanted me to stay home from school, but I declined for I had quizzes that day. I sat through US history, algebra 2, and even tried to eat lunch. Still in agony. So, after finishing my English quiz, I waddled down to the office and called my mom to get me. At this point, the pain is so bad I can barely stand. So my mom takes me to the doctors. Turns out, my appendix was ready to explode. You should have waited a little bit longer. You would have felt a lot better. I'm not a doctor, but this happened to me. I have suffered from chronic earaches and ear pain since I was a few months old. When I was in 8th grade I was sitting in class when my ear popped, except this wasn't the normal pop that releases the pain. It felt like someone had shoved a red hot metal rod in my ear. Under closer inspection by my pediatrician, who has dealt with my ears my whole life and is one of the few doctors that believed that I was in pain, and he said it was the worst eardrum rupture he had seen. But since I have had this happen a lot, I just took some medicine and went home. Over the next few months my earaches got severely worse, so I went to see an aunt who basically told my family nobody's ears hurt this much or are this sensitive. He is faking to get out of school. After my 5th visit in a month to that end, he suggests a MRI. At least I think that's the big circle thing with the magnets. Ends up that bad rupture had caused the skin in my ear to grab onto the bones in my ear and form a tumor called a cholesteatoma. This tumor was literally eating away at my ear, the bones in it, the cartilage, and was eating into my skull. I went to see a specialist for this, who ended up removing the tumor after a few months and having to completely reconstruct my eardrum and the bones, and a lot of the damage could have been stopped if the original aunt had believed me about my chronic pain. The result in all this is that I have an artificial eardrum made from the muscle in my jaw. They kinda botched that part, I think, because I can't even chew food really with the left side of my jaw after it. And the bones were replaced by the cartilage from the outside portion of my ear. The surgery resulted in bad nerve damage that makes every day a struggle, and I can't hear out of my left ear. TLDR. I had my eardrum burst, which resulted in a tumor that wasn't noticed by a doctor because he thought I was faking. Had the tumor removed, but I lost my hearing and have to deal with pain from the nerve damage every day. My mother was in town visiting for Christmas. Suddenly she was slurring her speech, acting belligerent, and all around confused. We tested her blood sugar and all it said was error. We get to the ear and she passed out. Her blood sugar was a 19. Her liver spontaneously failed. The best the doctors can guess is she caught a virus and it attacked her liver. 4 days after the onset she got a liver transplant. A 22-year-old woman in Baton Rouge, Louisiana gave my mother the ultimate gift. Please, become an organ donor. Please. 16yo here. Got my license like 3 weeks ago. Already an organ donor. My basic thinking is if I'm dead I don't need them anymore. Not a doctor but a nurse. I was working in postpartum care and I cared for a patient who had come into the hospital in labor with her first child. She ended up requiring a C-section. In the OR, they opened her up and found her belly full of cancerous growths. They immediately paged an oncologist at a neighboring hospital. We were just a women's and children's hospital, to come immediately while she was still open. It wound up being terminal. She wouldn't even have known if she hadn't needed that C-section. Can you imagine going to the hospital to have your first baby and leaving with a diagnosis of terminal cancer? I think about her all the time. As a physician, listen to your bodies. You guys know yourselves much better than we will, even after talking to you in for 5-10 minutes. If something is going on that is far outside the usual, please come into the air. I would much rather see you and tell you you're fine and worried well, than sick beyond the point of repair and a fool for having ignored your symptoms. Too bad the costs are absurd. Not a doctor either, but this happened to me. About 4 months after I had my son, I started to notice the vision in one of my eyes was really off, blurry, spotty, etc. I didn't really think about it much because my eye didn't hurt and wasn't itchy and I had a new baby to take care of. Anyway, it lasted for months and finally my mom and sister convinced me I had to go to the eye doctor for it to see what was going on. I took baby with because I thought, hey, quick apt, maybe 20-30 minutes and I'll probably leave with some eye drops or something. Honestly, one of the worst days of my life. They put me through test after test. I was there for hours. I ended up calling my mom to come get the baby. They weren't telling me anything. They scheduled an MRI for the next morning because by this time my 11 AM appointment had dragged out until 5:30 PM and the clinic was closed. We were the only people there. Still no answers. I am freaking out. Go back the next day and get the MRI done. They send me to the neurologist this time, no ideas today. When I walk in he has all the results from my tests the day before and the MRI I had just taken a while before. I was told I had multiple sclerosis. It was very scary. I worked in a fast track when a mother brought her 8-year-old daughter for abnormal discharge. Aside from the age, this is nothing unusual as we see many complaints like this throughout the day. The mother thought nothing of it, maybe she's on her period. The doctor, however, was suspicious from the start, so he ordered a gonorrhea chlamydia test which turned out positive for gonorrhea. Unfortunately, we had to discharge the patient on the initial day due to some tests, such as cultures, taking much longer to result. But the very next day we checked the results and immediately started calling CPS. The mother was not happy, to say the least. Dad went to the optometrist. She noticed something funky in his eyes, blood vessels. Referred him to cardiologist. 390+% blockages in his heart. Not a doctor, but I was taken to the ER for what I thought was a small infection, even though my arm went numb cold. For some reason I was entirely emotionally distraught and couldn't think clearly. The doctors took care of it, and I ended up not being able to use my arm for a week. Turned out, it was a staph infection, and I was told that if I had waited 2-3 more days it probably would have killed me. Staph. Not a doctor, but a couple of years ago my mother had lump in her breast, so she went to get it checked out for breast cancer. Her mum died of breast cancer and her sister has had it twice and has had her breast tissue removed. Fortunately, however, it was just a cyst. But wait, there's more. Turns out hiding behind that cyst was some early stage cancer. Was easy to get rid of and she's fine now. We had a guy who showed up to the ED with a bad cough. His wife kept saying that she had tuberculosis 20 years ago, and although she was treated at that time she was convinced he had it. His symptoms were far more consistent with pneumonia and he lacked classic TB symptoms. We got an X-ray and sure enough it was TB. Now I have to do several blood tests over the next few months to ensure I don't have TB. Sometimes the patient is right. Another time I saw a lady in the ED with a chief complaint of headache. She basically provided no history and just kept repeating that her head hurt. I tried to get some background, past medical history, etc, but she wouldn't say anything other than my head hurts, give me something for the pain. On her chart she had tons of previous visits for vague complaints and requests for narcotics which all resulted in basically nothing. So I initially thought maybe she was drug seeking, but her behavior just seemed odd. We decided to scan her head and left to go see other patients. I came back a few minutes later and her husband was there now. I asked what happened and he said she was just standing in the kitchen cooking when all of a sudden she dropped to her knees and then immediately complained of a horrible headache. While I was talking to him she began vomiting all over herself. We rushed her to CT and she ended up having a subarachnoid hemorrhage, bleed in her brain. She was taken straight to surgery and ended up being fine after spending about 6 weeks in the hospital. That sounds like tiny spiders bleeding all over her brain. Pharmacy student. One of our first real patient encounters was within a free clinic. Lady gets there, and after going through the routine questions, complains of an itchy foot. Okay, we'll look into that. We were being graded on this by our professors, who were sitting in with us. But we had to keep on task, aka make sure you go in a specific order. So I'm going through this lady's meds, all is well according to her, takes all meds on time. Though she doesn't exactly remember the names of them, a large part of the assignment was to teach us how innocently ignorant some patients are. She's getting her refills on time, seems to check out. I see you haven't refilled your diabetic monitor strips in a while. Are you in need of those? Oh, I haven't used that in a few months. It broke. Oh, well, it's important that you start using that. Skipping some irrelevant talking. Okay, so let's check that foot out. Horrible hygiene and signs of developing necrosis, but caught in time. This sweet old lady had no idea her diabetes could cause such a problem. I thought I had the flu with a bit of a rash. Turns out I had measles and due to sleeping too much I was massively dehydrated. My temperature was around 41 Celsius, and that was sat next to an open window in January. Yay. Vaccinations really do save lives. We got an older patient in the ER because he fell from a stool while replacing a light bulb. The family just wanted him to be checked because he fell on his head. He had nothing. While waiting for the papers, the family started to scream, "Doctor, doctor," when we rushed, and it seemed as if he was having a cardiac arrest. We put him back on the bed, hooked up an ECG. He had an AV block, so the reason he probably fell from the stool was because of the AV block. At first he was such a happy guy and joking around. After we told him what he had, he could only say, "It's in my heart. This means the end is coming." And then BSP, TL, DR, came in because he fell from a stool, fell because of a heart condition. And that's why taking a thorough history is so important. Ascertaining that it wasn't a mechanical fall, i.e., dizziness and not clumsiness, might have caused someone to put dots on the second he got into the ED. Poor bugger. Nurse here. I was working a shift in a busy emergency department and a man in his 60s walked in with vague abdominal pain symptoms. After waiting for over an hour in the non-urgent section, he came up to the counter saying his pain was worse. He was calm and polite through the whole thing. Next thing we knew, he collapsed and his heart stopped. Turns out he was having a massive heart attack. We amazingly got his heart going again, and just before we sent him to the cath lab he was sitting up and was as calm and polite as before. Went in for nasty stomach pain. I have PKD, so I thought something happened to my kidneys. The doc said it was just constipation. When I asked for pain meds he said no, and the nurse said, and I quote, "Sorry, you didn't get the diagnosis you were looking for." Woke up the next day, pee blood. Went to another hospital and they saw I had a hemorrhagic cyst burst inside my kidney. I ended up losing half of my blood. Sorry, you didn't get the diagnosis you were looking for. Holy crap. That makes me so mad. I get that there are drug seekers out there, but Jesus Christ, at least feign some kind of compassion. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.